Marcus Cooper said 56% of U.S. consumers like the idea of remote healthcare. 41% prefer care delivered by a mobile device. They prefer that. They're raising their hands and saying, great website, thanks very much, I appreciate the pamphlets, love the emails, love the direct, whatever. Can you get it to me on my mobile device? Almost half. This number will go up. That's what they're asking us as marketers to deliver. So a couple of trends. Some folks already talked about compliance. Mobile is brilliant for compliance. This is a good picture of an ecosystem, the phone's in the middle. Look at all these different things, right? The patient can wear a sensor on their wrist. They can have something that's part of an EKG combination technology with their heart. All these things connect with your phone, and what I've heard someone call this before is it makes your body almost a URL. If you don't know the idea of the Internet of Things, it's the idea that everything, this computer, this table, in 5 or 6 years will be mapped and will have a URL. Sounds crazy, but IBM, Cisco, major companies around the planet are literally mapping the planet. So as you walk through the world with your mobile phone, you connect to things, right? So you can see how you as the person, you're the hub, that phone is the hub, all these things. Hey, you get a text for yourself, your EKG, something's wrong. Hey, you haven't used your glucose monitor in the past 10 hours, and it can also be sent to your doctor. Here's the quote, Hippocrates, who I'm a big fan of, their technology is excellent. Walgreens, they have an app together that what it does is it lets a doctor at the point of prescription say, hey, let's find the nearest Walgreens to you that has your prescription, the one I'm writing for you, and that also you can afford, right? So it's a very, again, utilitarian app that lets people, whatever much money they have, get the prescription they need right away. This is a quote from a family practice physician. When I prescribe a medication for a patient, I'm not always confident they'll get it filled. Now with access to this app, I can give them an affordable option and definitive location to pick up the prescription. And hopefully this will make it easier for patients to comply with their drug regimen and be easier on their wallets. 41% of consumers want this, right? Partner with Walgreens, partner with whoever it is. From a marketing standpoint, find the partners who want to do this type of thing, and get a deal going and delight your consumers and help people where they need it the most. Another trend I'm very interested in, kind of geeky, so enjoy, last talk before lunch, self-monitoring. So this is great. I can send you the link if you want it. I found this an amazing set of decks from Stanford University. There was a mobile health conference this year, this past summer. What now you can do is using microphones and sensors, you can do what's called self-monitoring. So in this case, John Froelich from the University of Washington has done these different tests. One is there's a microphone in a person's ear that detects when a person is eating with 99% accuracy. Who here has filled out an accurate food journal after watching Oprah? Not me. Pop Rocks and Coke 4 times, right? This actually knows when you're chewing and can say things like, you chewed 14 times today. The 3rd time you chewed for a longer amount of time, we assume that was a meal, right? It's not going to say that to you, but that's the data that this starts to combine, right? You self-monitor, actually have a picture, a data map of your existence. Here's another test that John Froelich did, using very cheap phones that just had a microphone. It detected when people coughed, right? So this was a bunch of students that went into a room, and when they coughed, it tape recorded, right? And it mapped the timing. I have 2 kids in school, right? You know the germ factory? No, it's elementary school when you send your kids, and what are you going to come home with today? I have Band-Aids and aspirin. This is a perfect example of understanding maybe how influenza, how a cold system, whatever, not just for an individual, but for an entire data set or group of people, right? And I'm fascinated by this stuff. A woman named Kendra Marble from Kaiser Permanente, they've developed this very cool app called WeightMate. And I love how they put it here. It's a complete solution. It's a mobile phone, a sensor you wear on your wrist, display on your phone, and social support. The entire cast of friends will call you. I'm just kidding. What it does say here is it actually talks about your moods, right? If you say to it, I know I eat when I'm worried, when I'm stressed, it can come and say, it's hard to read, you've been eating when you feel tired a lot recently. Being tired can make you feel hungry. You aren't. So it comes to you when you've said throughout the day, I get stressed at 3 o'clock. For some reason, coffee hour, whatever. So you get a message like that, and you can be encouraged from friends. It's a good comparison to having, what's the term for alcoholics, a sponsor. keep track of you socially. Then there's
Your mic keeps going in and out. I don't know if something's going on with it. You want to try this one?
yeah, my mic keeps going in and out, apparently.
What?
I'll text you. Is that better? Alright. So here's what I love too is voice recognition, tracking of foods consumed and mood at the time. So again, if you don't have a pen to write it down, you can say I'm eating fish, or you can say I'm eating fish and I'm really mad. Love the idea of the mood part of it. I hate this pasta. So texting, we've got a lot of great examples of texting. Some before talked about text for baby. I do wish we had this for dads. You know, seriously, because when my son was born, I was totally stressed and would have loved like half-off beer texts or something. Didn't get them, but it's an amazing app. This now, I got to talk, this is brilliant. I forget the name of the person, I'll send it to you if you ask me, but this now in third world countries using a computer hub, and they don't even need a phone signal. They use mobile phones, but they don't need a phone, they don't need, a wireless signal. They don't need wireless computer. They just need a mobile signal. What this can do is, number one is, there's a person, a healthcare professional out in the field, and there's a patient, a local person from that area who's missed an appointment.